Hi, my name's Jackie Huber. I'm an advanced trainee in psychogeriatrics and a clinical fellow at St Vincent's Hospital, and I'm going to talk to you today about a new service called Psychogeriatric SOS that we're starting up at St Vincent's, and I'll be joined by Claudia Wolfe, who's a neuropsychologist at St Vincent's Hospital as well. So the psychogeriatric service at St Vincent's started in 2003 and was set up by Professor David Burke and was built to include 10 full-time clinicians eventually. The Psychogeriatric SOS service, or Psychogeriatric Services on Screen, was conceived of in 2010 and has finally been funded by the St Vincent's Curran Foundation in 2014, as well as the Institute of Psychiatry and the New South Wales Ministry of Health Integrated Care Planning and Innovation Fund. So this is where we are. You can see on the map that we're right near the Sydney Harbour Bridge. And we're quite a small geographical area, but we do cover quite a large population, which is quite transient. We service about 15,000 people over the age of 65, and it's quite a unique and diverse population, which includes, for example, a very wealthy population, a large homeless population, a population of Holocaust survivors, as well as ageing sex workers, for example, and drug users, and also ageing people with HIV. About 6% of those 15,000 people have mental health issues, and about 6% with cognitive impairment, making up about 1,800 people in all. We have 156 GPs in our area. We service 565 residential aged care beds, and we usually have about 250 active clients at any one time between the mental health and the dementia service. In all, we service that number of people with 15 full-time clinicians with access to 2 to 4 inpatient geriatric mental health beds. Our beds are co-located with the geriatric ward, and that's not many beds for the number of people that we service. And I'll tell you a little bit about why we manage, or how we manage with so few beds, with so many people that we service. This is our team. We recently went kayaking in Sydney Harbour, and you can see we've got 2 psychogeriatricians, a registrar, a number of nurses. We have a number of clinical psychologists and a clinical neuropsychologist, social worker and occupational therapist. And our operational mode of care is very flexible. We operate throughout the cycle of care, from health promotion, early intervention and crisis response, all the way around the other side of the cycle to acute care, short to medium term intervention, rehabilitation and relapse prevention. And we can come into that cycle at any point. So if we're needed at the early intervention stage or the short to medium term stage, we make sure that our response is sufficiently flexible to be able to do that. While our service model is concentrated in the hospital and community setting, we like to concentrate on the primary care. We feel that that's the most efficient part of the health service of New South Wales Health, and we try and maintain that focus via support and liaison of our GPs and community health workers, supervision and case review for those workers, education and training, and clinical resources. So in terms of education and training, we provide educational sessions to residential aged care facilities in our area, as well as symposia for GPs and for community members as well. And we've provided a number of clinical resources, and here we have one example of the psychogeriatric handbook that our team has written. We aim to have the appropriate tailored response to whatever is required. So we like to provide a response in a timely way, in the most appropriate environment, whether that be inpatient, outpatient or community setting, using the best available expertise, that is the member of the team that's most appropriate to that patient's requirements at the time, with the right amount of support, that is the support from the rest of the team. And the aim is really to create a seamless experience for the patient, so that whether they're an inpatient, an outpatient or in the community, they are engaged by the entire team and see particular members of the team depending on what their expertise, depending on what expertise is required at that particular time. In terms of the Psychogeriatric SOS service, what we aim to offer is a new e-health model for psychogeriatric rural outreach, using the model that we have set up in terms of our psychogeriatric service at St Vincent's. So the reason we feel that this sort of a service is required is essentially the matter of resources in the rural area. So as you can see, this is the population that we understand that Northern New South Wales takes care of. So there's a population of about 289,000 people, 52,000 of which are over 65, 6,800 of which are over 65 with mental health problems, and 3,260 approximately, which are over 65 with moderate to severe mental health problems, and those are the people that we feel are most likely to need psychogeriatric input. So in terms of the services that are currently available to the Northern New South Wales District, the resources are quite sparse. So there are a number of people on the ground who do an amazing job, but unfortunately they do have access to sparse resources. So there is telehealth available, but we know that that's been taken up in a way that didn't quite meet expectations. And we know that there's fly-in, fly-out services as well, but we understand that that does still provide little access to psychogeriatricians, for example, on the ground. And what we hope to do is add on and build on these resources that are currently here. So what we hope that you will do is to capitalise on our team's multidisciplinary expertise within your current local framework. So this is you as the clinician. We intend to provide a web-based service that is via telehealth, which provides information and advice, clinical guidance, professional supervision, case conferencing, education and training, and indeed whatever you feel you need that we can offer via a web-based platform. So this is how it works. You, the clinician, would access our website, and the website would alert our SOS clinicians to the fact that you had requested an interaction. Our SOS clinician would get in contact with you, obtain some more details, and figure out what exactly is best for you in your situation and what we can offer you using the SOS strategy. And these are just a few concrete examples so that we can both understand exactly what it is that we're offering. So here we have a remote community hospital psychologist who's case managing a 72-year-old farmer with depression. And the psychologist has a lot of experience in adult psychology, but not a huge amount of experience in psychogeriatric psychological interventions. And so he'd like to discuss it with an SOS clinical psychologist who has a lot of experience in psychogeriatric psychological intervention. He says to her, I'm not really sure what type of therapy is best for this particular client in the context, for example, of his cognitive impairment. And the SOS clinician may say, well, that's a good question, and some of the strategies are a little different in that context. Have you tried XYZ? And so the psychologist goes away and uses this strategy and comes back and says, look, thanks for the advice. It worked, but then now we've got these problems, which I'm not 100% familiar with. And the SOS clinician may get back and say, yes, I've come across that before. I think the next step is whatever. My next example is of a rural social worker who's managing an elderly man who's living in squalor. And she's not 100% sure whether he can consent to clean-up or placement, for example. So she would like to speak with an SOS social worker who has daily psychogeriatric experience and is an expert in squalor, and indeed our social worker is. And so the rural social worker would ask our SOS clinician this question, and the SOS worker might say, well, this is the context in which you need to start to discuss capacity. And so they have a discussion about it, and they set up a number of sessions where they can discuss exactly what capacity is. And finally, the rural social worker may say, look, thank you for that advice. We really have no squalor-specific interventions here. And I'd really be interested in trying to set something up. What would I need to do? And our social worker might say, well, there's a series of steps that's required in order to set up a service, and this is what you might like to do. This is an example of a rural GP who's relocated to a small town and has 4 elderly people with cognitive impairment. And he'd like to speak to a number of SOS clinicians to ask advice. For example, a consultant psychiatrist, an SOS social worker, a clinical psychologist and a clinical nurse specialist to make sure that he's covering all bases for these 4 patients. And he can have a case conference with these 4 SOS clinicians all at once, and they can have a discussion about what might be best to do for this group of patients. This is an example of a rural director of nursing in a residential aged care facility who wants her team to be upskilled in behaviour management for patients with dementia and mental health problems associated with their dementia. And she wants to talk to an SOS Psychiatric Advanced trainee who has experience in behaviour management and also education. And the SOS clinician may say, well, I can see that you've got this residential aged care facility team, so we can discuss what aspects of their behaviour management strategies need to be upskilled. And so essentially what I'm describing here is that you, the rural clinician, can access one or many SOS clinicians for any type of interaction that you think might be useful in a web-based context. So this is our email address that you can contact us on, but at the end I'm going to show you any number of strategies that you can use to call us, and we really hope that you'll call us to use our service. Thank you.
Hello, my name's Claudia Wolf. I'm a clinical neuropsychologist and the project officer for Psychogeriatric SOS, and I work at St Vincent's Hospital with Jackie. Today I'm going to be talking about e-health service resources, evaluation and development, and why we really need you. So what we're providing. So as Jackie has just said, Psychogeriatric SOS will provide truly integrated clinical care through web-based conferencing. We will provide individually tailored clinical guidance, clinical review, case conferencing, supervision, and education to fulfill three primary objectives. The first is the facilitation of our multidisciplinary team. So the St Vincent Psychogeriatric multidisciplinary team communicating and integrating with rural and remote clinicians in primary care and in hospital and community settings. Second, we hope to provide a sustainable and cost-effective psychogeriatric e-health service. And finally, we want to support, upskill and empower you as the lead clinician to assess and manage the mental health needs and dementia-related concerns of your older patients. And to do all of this, we're going to use web-based resources. So as you can see from this screenshot, you can access a number of different resources from our website. So we believe that good resources are invaluable in helping us to support and upskill you to assess and manage your older patients more effectively and more efficiently. So we've put them on the website, as you can see, all in one place, so they're very easy to access. And you'll also see that we have a number of education videos on a range of different topics presented by a range of different clinicians on our team. You'll also see on the website that we have developed two resources of our own. The one on the left, Homeward Bound, is a psychogeriatric program for managing and preventing symptoms of depression in older adults, which our team at St Vincent's Hospital developed. And the resource on the right, which Jackie alluded to earlier, is the St Vincent's Hospital Handbook of Clinical Psychogeriatrics, which has a range of different psychogeriatric related concepts. And you'll see on the website that we have one chapter up. So that's behavioural and psychological symptoms of dementia. And you will be able to access all the chapters eventually on the website. So what we're providing. So through web-based resources and conferences, in hospital and community settings with a primary care focus, we will provide support and liaison, supervision and case review, and education and training. But to make this work, we need you. So the Psychogeriatric SOS service has been funded by the Ministry of Health, but for you as clinicians, it's a free service. The Ministry of Health has given us funding for the first year, but in order for us to receive the funding for the second year, we need to demonstrate the usefulness of the service, the true costs of delivering the service, because we actually don't know, and service evaluation and development. And this is where we really need your help. So, as Jackie alluded to, this service is a clinician-to-clinician based service. And you might be surprised to hear that something like this has actually never been set up before. People have used components of what we're doing here, but no one has pulled it all together in a comprehensive way like we are doing. But to make this work, it really needs to be collaborative. We really need your help. And we need to start that process with evaluation of this service. So in the first instance, evaluation will measure service uptake and demand, user satisfaction and criticism, and the utility and efficiency of the technology. So basically we want to know how useful our contact with you was. What did you learn? What could we do better? We want to know whether you would use our service, how satisfied you were with our service, and whether you would use our service in the future. We're also interested in whether your confidence as a clinician increased. So prior to accessing our service, how confident were you in assessing and managing, for example, behavioural and psychological symptoms of dementia? And did your confidence increase following your contact with us? We're also interested in patient outcomes. So we can't make you complete these forms, but we do strongly encourage it. Those that are listed here are what the Ministry of Health requires for mental health care provision, and I'll just go through them really briefly. So we have the HONOS. The HONOS is a 12-item measure for mental health service users. It's rated by a clinician before and after intervention, so changes attributable to the intervention can be measured. Next we have the K10 or the Kessler 10. It's a 10-item measure completed by the patient, and it's a measure of psychological distress. And finally we have the RUG-ADL, and the RUG-ADL is a measure of functional dependence, and as you can see it measures 4 different domains of functional ability: bed, mobility, toileting, transfer and eating. Okay, so how will this actually work? So service requests from rural and remote clinicians will be made using the existing psychogeriatric intake service. So by a dedicated phone line, a dedicated mobile line, a fax line and an email. And will be supplemented by the psychogeriatric website. So as soon as the clinician makes contact with us, they will be taken to the website, if they haven't gone there directly, by the SOS intake officer. At that point, they will be asked to register. And you can see on the screen, you just have to click that Register Now button, and then you'll be taken to the registration page. So the registration page is completed once, the very first time the service user accesses our service. It's important, enables us to evaluate our service, and it basically gives us an idea of how you anticipate you might use our service, both at the time you make that initial service request and also in the future, more generally speaking. So as you can see from the screenshot, you are asked some basic demographic questions, questions about the setting in which you work, the level of multidisciplinary support you have, and then you can see on the right a list of patient related issues, and you're free to pick as many or as few of those as you like. After registration is complete, then you'll book in the web conference. So as you can see from the screenshot, you just click that Request a Web Conference button, and it will be at that time where you specify your needs. So how long you anticipate you might need, how many and what type of clinicians you think you might need. And there'll also be the capacity for us to respond to more urgent intake referrals. And we will respond to those like we do locally. So the intake officer would triage and prioritize and allocate the most appropriate clinician to follow up with that. But just to make a note that this service isn't an acute service. We operate in regular business hours. On the website, you'll also find a very clear description of minimum requirements for web conferencing and a step-by-step illustration of exactly the steps you need to take. So after the web conference, we'll be asking you to complete a confidence questionnaire, both prior to the web conference and following the web conference. So this is what the questionnaire will look like. The pre and post questionnaires are essentially the same, other than the pre-questionnaire asks questions pertaining to prior, to your contact with SOS and the post-questionnaire ask questions following your contact with SOS. And you'll get a list of questions like those listed here, and you will choose the most appropriate answer from the drop-down box, and there'll also be the option to click NA. And I've completed this program and this survey, and it took me less than 3 minutes. The post-confidence questionnaire will be supplemented by a short satisfaction survey. So we basically just want to know whether your contact with us was helpful. What were we good at? What were we less good at? How easy was the technology to use? Did you have any problems with the software? We just want to hear from you because we want to make this work. So contact us. Call us, email us, fax us, whichever you like. But to make this work, it really needs to be collaborative. We really need to hear from you. We want to do the best we can by you to support, upskill, and empower you as the lead clinician to assess and manage the mental health needs of your older patients. But to do this, we need your help. Thank you.